Hi, I'm District Superintendent Lisa Hitchens, and with me today is one of our district nurses, Lori Carbonell. And today we're here because we wanted to answer some of the questions that you've been asking. And the two topics for today are symptom checking and COVID cases in Batavia in our school system. And so let's start with symptom checking. And I would say that not only is symptom checking required, but it's also our best way to keep our community and our students and our staff safe. And what that looks like for you as a parent is every day you are checking your child for symptoms, and you are keeping them home if they are not able to pass that daily screener. And so, Lori, my question for you would be, what does that daily screener, how did you come up with it, and what happens if they don't pass the screener?
So working with our technology department, we have developed a screening tool that matches the CDC guidelines. Those guidelines might be changing, and when they change, we'll change with them.
Right.
If they don't pass the screener, you'd be wanting to stay home for the day. It doesn't mean you have COVID, but it does mean you need to stay home and do a remote learning option that day.
Right, and I think that's the important part for the parents and the students to know. This is a different year than past years. Our teachers are going to have two lesson plans, one for the kids in front of them and one for the kids who are at home. So keep your child home. We've got you covered. We've also received many questions about what happens when there's a COVID case. And parents need to know that if your child receives a positive COVID test, or if your child is told by a medical professional that they need to self-quarantine, you need to know this one thing: call your school nurse. And I'm going to turn it over to Lori to talk about what happens when they make that phone call. What's going to happen on that call?
So the school nurse will contact the district nurse assigned to their building, and we will initiate as certified contact tracers that contact tracing process, notify the health department, and walk you through basic next steps.
Lori, after you find out about somebody's COVID status, who else will be contacted?
Well, our first contact will be the Kane County Health Department, and working with them will determine what part of contact tracing the school will do and what part the health department will do. For the school, we'll be talking with the person who's positive or considered a close contact, verifying they know what next steps they need to take, and then reviewing who their close contacts may be. When we go through the close contacts, we'll be contacting them as a contact tracer, but not revealing who the contact was or who the positive case was. We just review the implications they would have for staying home, staying in quarantine, isolation as it applies.
Great. There's probably just a couple more questions. One of them I'm going to ask Lori. As a parent, they're probably wondering, if a child in my child's class tests positive, will I know about it?
Maybe. So if you've been identified as a close contact of a positive case, you'll get a phone call from the district nurse. If you are not identified as a close case, your child's not a close contact rather, then that is really going to be up to the health department. We will be working with the health department to determine who needs to know and how they need to know.
Great, and I think that what people do need to know is that last question of how is the district monitoring its local data, and I would say that we're on a team together that monitors daily and meets at least once a week, and the data that we're looking at are the cases that are in our schools, the cases that are in Batavia and Kane County. There's dashboards out there that also give us some good feedback. And what you as a parent need to know is that as a district, we are flexible, and we're going to make changes based on the data that we see. And that's why our on-site plan, we've been calling our flexible plan, because we're going to have to be able to respond based on the things that we see in front of us. So we might need to go from everyday to hybrid to remote based on what we see, because we have your child's safety at heart. It's our number one priority.